Hi, I'm Garvin Lynch. Welcome to Lynch's Pharmacy Health video series. This video is on hay fever. So hay fever, without a doubt, is one of the most common ailments seen in a pharmacy, in society, especially during the summer months. Hay fever is a form of rhinitis. You can have rhinitis all year round, which is called perennial rhinitis, or you can get it for just a couple of months of the year, which is when we call it hay fever, usually during the summer months. It's caused by people being oversensitive to certain components of the atmosphere, most commonly pollen, dust and air pollution. It's pretty easy to recognise symptoms, which include watery eyes, sneezing and congestion. It can sometimes be hard to distinguish from a common cold, but there are a few things that give it away. For example, people with hay fever often have itchy palms, and itching the roof of their mouth can often be quite itchy as well. Furthermore, if you're still not sure if it's a cold or hay fever, maybe family history would give an indication. Hay fever actually runs in families, as well as asthma and eczema. These three conditions are all related. As well as that, if it has been going on for a month or 2 months, it's probably more than a cold and may well be due to an allergy. So all of these nasty effects, the sneezing, the watery eyes, they're all caused by the release of histamine in the body. The standard treatment for hay fever are antihistamine tablets. So most people's hay fever can be controlled by taking one of these antihistamines. The most popular ones are Zyrtec, Claritin and Piriton. The Zyrtec and Piriton are both just once a day tablets. Zyrtec can be used from the age of 6 and up. Claritin can be used from the age of 12 and up, or from the age of 2 and up if the child is over 30 kilograms in weight. So it depends on the size of the child. The Piriton can be taken 1 every 4 to 6 hours, generally 3 in a day. The Piriton can be taken from the age of 6 and up. Now the Claritin and the Zyrtec are technically non-drowsy tablets, but they can still make some people drowsy. Not a lot of people find themselves feeling drowsy with these. Yeah. The Piriton, on the other hand, is drowsy and does make a lot of people drowsy. So it's important to make the patient aware of that. There are some generics of these out in the market. For example, there's one Clari's, which is Claritin, a generic form of Claritin. It's the same drug and does the very same thing. It's just a little cheaper. Probably the only advantage to it that it comes in a box of 30, and Claritin and Zyrtec only come in boxes of 7. A lot of people would rather have a month's supply than rather just a week's supply. The Phenergan then is a liquid, mainly for use in kids. It can be used in adults as well, but they'd have to take quite a lot of dose for an adult. Again, this is drowsy. It's very useful if kids are having trouble with an itch or any other symptoms at night. It should give them a good night's sleep and relieve any of those symptoms. So Zyrtec and Claritin are non-drowsy and are taken once a day. Piriton and Phenergan are drowsy. Phenergan is taken at night and just for kids, and the Piriton usually taken 2 to 3 times a day. So antihistamines are great for treating the general symptoms of hay fever, like itch and watery eyes. But what they don't treat is the congestion, which can be quite bad in some people. So there's a few products available to treat congestion. There are others, but the main ones would be Zyrtec is a fantastic product, and Zyrtec decongestant has a decongestant in it. It's the same as an antihistamine for the standard Zyrtec, but there's a pseudoephedrine, a decongestant in it as well. The pseudoephedrine is in a lot of the decongestant products. So a couple of things to know about it. It can only be used in children over 12, and before any product containing pseudoephedrine is sold, it must know if the patient, if you have hypertension medication, so tablets for high blood pressure in effect. The reason being that the congestion comes about by inflammation of the lining of the nose, which causes the blood vessels to dilate. That's what gives you the bummed up feeling in your head. And pseudoephedrine and other decongestants, what they do is they constrict those vessels and shrink them back down to normal size and thereby relieve the congestion. The problem is they don't just work on the vessels in the nose, they could constrict vessels anywhere. So if you high blood pressure, the last thing you want is your vessels constricting and increasing the blood pressure further. So be careful with pseudoephedrine if you're on high blood pressure tablets. So that's Zyrtec decongestant. It's for use in over 12s and one twice a day. They're also called local decongestants. So these are just decongestants that you apply to the affected area. So they're nasal sprays or nasal drops. Like Artrovine is just one of a range of them. So again, it's important for the patient who's on hypertension medicine to be aware that decongestants can increase your blood pressure. Also, these products are for over 12s only, and the spray, you just spray into both nostrils 2 to 3 times a day, and it's very effective. And the main thing with local decongestants, so any nasal spray, is that they're not used for any longer than 7 days. The reason being, if you use them beyond this, what will happen is a condition called rebound congestion. So it essentially makes the condition worse. So 7 days maximum for any decongestant nasal spray. Now if the symptoms are very bad, and if you've bad congestion and sneezing, often people turn to steroid sprays. And that's what we have with Becanase and Flixenase. The thing about steroid sprays is that they have to be used regularly. Whereas your antihistamines like Claritin and Zyrtec, some people take them only when they need them, when the symptoms are bad. However, the steroid sprays have to be taken regularly, so every day. But having said that, they shouldn't be used for a prolonged period of time. So 6 months maximum in general is what they say to use steroids for. The Becanase is for use in over 18 years of age only, so it's quite high age limit, and use it twice a day. The Flixenase can be used in over 12s and just used once a day. So as I say, these have to be used regularly, whereas the antihistamines can be taken as you need them. Now if you have very bad symptoms in your eyes, so your eyes are very itchy and watery, there are eye drops available. Opticrom contains anti-allergy medication called sodium chromoglycate. There are other eye drops out there with the same medication in them that do the same thing. It's a fantastic product, and it's a couple of drops about 4 times a day, and it should dry up watery eyes and relieve the itch. And finally, the Olibus inhaler, which is almost a natural product, I suppose. It's just a blend of oils like eucalyptus oil and peppermint oil. It works very well for some people to relieve congestion and painful sinuses. All you do is place it under your nose and inhale the vapours, and it can be used in children over 7 years of age. If you have any questions, you can email me or contact me through the website, through the Live Pharmacist, or just call into the pharmacy in Broaddale and Douglas up Maryborough Hill. Thank you for watching.